In today's Community Focus, we are talking with doctors on the front lines of the coronavirus pandemic.
As hospitalizations continue to surge, members of our community are now hospitalized in field hospitals set up in both Cranston and in Providence at the Rhode Island Convention Center. One doctor leading operations at the Convention Center is Dr. Cathy Duquette, the Executive Vice President at Lifespan. And Doctor, we want to thank you for being with us today.
Thank you very much for having me.
We know there was at least one patient at your field hospital yesterday. Can you share with us how many patients are there right now?
Sure. By the end of the day yesterday, we had 11 patients that were transferred to our alternative hospital site at the Convention Center. Today, we anticipate having about 22 patients by the end of the day. We have about 6 of them, the last 6 being transitioned in right now.
And Doctor, can you walk us through the procedure, how someone ends up in one of these field hospitals?
Yes, great. Any patient who is currently in our hospital who is COVID positive requiring general inpatient level of care, we are identifying them for placement at the alternative hospital site. We are placing patients who have already passed through the initial phase of their hospitalization, or some patients who present to our emergency departments who need hospital level of care and who are relatively stable at the point of hospital entry. When the decision is made for transition to the alternative hospital site, that site is under Rhode Island Hospital's license, so we treat it as if it's a transition from one unit to another unit. The attending physician has a conversation with the patient. Our social work team reaches out to the patient's family just to confirm the transition, and via ambulance, we transition the patient to the alternative hospital site.
So we know certainly through this process what that means is COVID beds are full and filling up, but what does this also mean for an emergency situation that's not COVID related and someone still needs emergency care?
So we encourage all of our community members to continue to use our hospitals. They are safe. We are testing our patients when they present to the organization, and we separate our COVID positive patients in our isolation areas away from our patients who are not COVID positive. So we do want our community to seek care and service and not delay.
And Dr. Duquette, I understand that the hospital at the Rhode Island Convention Center was slated to be decommissioned. How dire of a situation do you think Lifespan would be in if that hospital wasn't available currently?
Well, we believe that having 2 sites available, one in Providence and one in Cranston, affords a better geographic dispersion of some alternative hospital beds. The Cranston site, as you know, does have the capability for up to 325 beds. We probably would have had to tap into those beds and concentrate them all in the center of the state. But by having 2 alternative hospital sites available, 2 of the largest health systems in the state driving those alternative hospitals, we've been able to basically divide some of the burden for staffing and getting those sites ready. And overall, it makes sure that we have much more capacity to care for the citizens of Rhode Island. Clearly, the citizens will need to help us here. They need to take the governor's advice seriously, take the pause. We need to stop this curve of the steep incline of demand for hospitalizations so we don't exceed our capacity from an alternative hospital site bed perspective.
And Dr. Duquette, I wanted to pivot a little bit and ask you about something that Lifespan's president, Dr. Tim Babineau, said on CNBC this morning. He said as soon as the hospital system gets its hands on a COVID-19 vaccine, he believes it will be distributed within just hours. So can you give us a little bit of a sense of how Lifespan is preparing to roll out the vaccine once you do have it?
Absolutely. We've been collaborating with our state partners, the Department of Health, and have internal plans here ready for mass vaccine distribution among healthcare workers and other populations according to the plan. So as soon as we hear and have the supply, get the word that it's good to go, we are ready.
Dr. Duquette, again, right on the front lines of what is happening right now. Our thanks for what you're doing, and also thanks for joining us live today at 4.
Thank you for having me.
And our conversation doesn't end here. The medical director of Lifespan's Field Hospital will be joining us in the next half hour to talk about what it takes to set up an alternative site like this one.